everybody, my name Margareta Deurati. I'm a student from Polteka Mangunwijaya Semarang. Today, I will give my opinion about case study 20, acting without prior consent due to an unforeseen medical problems.
Case Study 20. Acting without prior consent due to an unforeseen medical problems. When Mr. M, a 52-year-old male, was referred to Dr. C, he was in a very serious state. His symptoms include fevers, head scans, dry tongue, sinus infections, and general septic poisonings. Urinalysis indicate his urine was badly infected. He had stone in his bladder and a large stone in his kidney. Dr. C operated on Mr. M in May, draining his bladder and removing the bladder stones. The patient was subsequently treated by injection and his bladder conditions improved. He continued to experience severe pain on his left side and had also developed a hernia. A second operation was performed to alleviate the patient's overall physical conditions. Several months after the second operation, Mr. M gave his consent to have surgery to repair his hernia. A day or two after the operations, Mr. M was informed by Dr. C that his testicle had also been removed during the surgery due to potential problem it might have caused. In response, Mr. M said he had not given his consent to the removal of his testicle and had never been informed that it might be necessary. Three eminent surgeons support the correctness of Dr. C's procedure. They state that no surgeons could have anticipated the conditions and that further surgery had been necessary. The question of this case is, should Dr. C have postponed the operations until Mr. M was able to give his consent?
My answer is yes, because in the informed consent, Mr. M only agreed to carry out hernia operations. Information approved by the patients is a concern regarding hernia surgery rather than removing the testicle. This is, of course, Dr. C actions outside of the agreement. Dr. C should have been waiting for approval from Mr. M for testicular retrieval surgery. This is because the patient is not on serious conditions as an accident patient. So there is still a chance for the patients to give consent for the operations to be performed. This case is not an emergency, so the doctor is obligated to send the procedure until the patient give his consent. In another view, if indeed the doctor consider the health of the patients to removing the testicle, the doctor should seek approval from the patient's family who is authorized. This agreement is determines who will be responsible for the operations to be performed. In this case, Dr. C did not ask for the patient's consent or patient's family. So, Dr. C is legally responsible for the operations. In my opinions, ethically, the doctor should removing testicles based on the clear consent from the patients. The patient has the right for his body and health. In standard operational procedure from any hospital, in non-emergency case, require a doctor to provide informed consent to the patients before taking an action. These approvals needs to be done so the patients aware of the side effect and danger of the operations. In addition, consent is needed so that if something unexpected happen to the patients and family can understand the risks based on the informed consent. This communications ethics is also needed as from the doctor works according a standard operational procedure and practice legally. Consent from the patients is needed before taking an actions. Okay guys, this is my opinion about case 2020. Thank you for you watching this video. Stay safe, stay healthy, and don't forget to like, comment, and subscribe this video. Thank you guys. See you. God bless you.